Hello, everyone. I'm Dr. Robert Shapiro,
I'm Teresa.
and welcome to another episode of the Intuitive Health Portal podcast. Today, we have another really good topic to discuss with you. This was a request, it was a suggestion by our podcast producer, and it's an awesome topic. It's basically healthy versus unhealthy relationships, or AKA toxic relationships. We'll put special effects in there to emphasize that.
Yes. When we had first decided to come up with this topic and discuss it, I actually went on quite the search to basically look up toxic relationships, and it's amazing, all the stuff that comes up. And then after a while, it kind of gets a little overwhelming trying to decide, okay, what am I actually going to focus on? So I actually found an article on Psychology Today, and it actually is what is a toxic relationship and 6 signs you may be in one. And relationships, these are not just romantic. These can actually be family, friends, workplace,
Government.
yeah, think of pretty much anybody that you interact with. And so one of the things that, I had first found is that relationships kind of fall into 2 categories, either positive or healthy, basically where the couple supports each other, shows empathy and compassion to the other person, and where both parties are willing to give and take. And then, of course, you have the other type.
The toxic relationship.
The unhealthy. Yeah.
I like toxic.
Unhealthy or toxic relationships generally are considered, as emotionally, sometimes physically harmful to one person. A lot of times what it does is it indicates a relationship that is built on conflict, competition, and the need for one person to control the other.
Yeah, that's kind of the main center point of it is largely control. And so, but interesting. I mean, like some signs of that examples of that would be like, jealousy, blame, gaslighting. In case you don't know what gaslighting is basically you sense something's amiss, and then you try to confirm it with the person, and they just deny. They make it seem like it's all in your head, and unfortunately, that is very common, especially nowadays.
Yes. Mm-hmm. And in the beginning, the negativity is not there at all. A lot of times it can take months, years before any signs of, the toxicity appears. And so in the beginning, the person can be extremely charismatic. They seem to be the ideal or perfect partner or, it's like person that has come into your life. And then, of course, over time, they start to show their true colors and become either controlling, demanding, and emotionally abusive.
When Teresa and I first sat down and made the decision to discuss this topic, one of the things that I brought up is that while this is, you see this very commonly, and most people probably think of relationships with like a significant other, more of a romantic relationship, I immediately brought up the fact that probably where we see it more often, especially in her practice, is with family and perhaps friends. Mm-hmm. Yeah. So, I mean, you can, and as a matter of fact, our last episode, we had discussed the whole kind of COVID situation, right? The pandemic and things that are going on.
Mandates.
Well, and one of the things that we have seen through this, so-called pandemic is that it seems like a lot of relationships, especially with family and friends, have gone from healthy to unhealthy now.
Yes.
Yeah, because people are basically kind of in this competition to see who's vaccinated, kind of their virtue signaling. There's a lot of virtue signaling. I got my vaccine. Why haven't you done your part, right? And so, and so on and so forth. And then you got the unvaccinated people that are calling the vaccinated people idiots and robots and, sheeple. And unfortunately, this is just, it's not really fixing anything. It's actually creating more problems. So,
yes. And, and then that's the thing that's been sad about this whole world situation is the division. And so, you think that, everyone that's been in your life, you have this sense that, it's like, oh, it's like, they love me, we're family, it's like, we're good, right? That they're always going to accept. And then suddenly in a moment's notice, it's like, oh, no, it's like, you're wrong.
Mm-hmm. Yeah, it's kind of, think about like the wedding vows in sickness and health, for rich or for poor, till death do us part. These morals, this moral compass, these ethical, backings that we have, right? These philosophies that we have. It just seems, unfortunately, that when the going gets tough, the boundaries break down, and I don't know, people I guess you could say they show their true color, or I don't know, they just change.
Mm-hmm.
Yeah.
Yeah. And looking at some of the signs and the various things that, can come out once those relationships start to decline and go downhill. And so in this article, signs of a toxic relationship, again, they don't just show up. And who knows? I mean, we've had some of our friends and family that have been in, relationships, and it could be 20 years down the road. And then all of a sudden, it's just a switch happens. And so some of the signs to look for is, big one, isolation. And basically the toxic person attempts to isolate the partner from family and friends to limit support and increase dependence on the relationship.
Yeah, anytime somebody tries to isolate you, that needs to be red flag right there, right? Your spidey sense needs to start tingling really strongly. And you need to start asking questions. You need to, at the very least, like, I'm not going to say confront, although maybe that's the appropriate way to put it. But you definitely need to, you have to talk to the person and find out like where they're coming from, and you got to get it. You got to get a sense of, what their intention is, and if they start using techniques like, blaming and attacking and gaslighting you. Those right there should be your big warning signals that this relationship has probably become toxic, and you have to make an assessment. Like, is it appropriate to stay in it? Can I, if they're that important to you, can you salvage it? But you need to be realistic about it. Like, many times you can't salvage it. Sometimes the best thing to do is just walk away, let the dust settle, and maybe they'll come to their senses and they'll come back and have a healthy relationship again. But sometimes that never happens.
Yeah. So, and kind of listening to on the isolation thing, say you're wanting to spend time with, friends and family, and they give every reason why you shouldn't. Mm-hmm. And then, so that's, kind of one thing is how much time am I being requested or required in some ways to spend all my time with this person. Another one, ongoing disagreements and arguments. And so the controlling is always berating, belittling, putting down the other person, or criticizing their attempts to do anything positive or independent.
Mm-hmm. Yeah. Yeah, exactly.
Yeah. Then, like you said, the blaming, right?
Yeah.
Everything is your fault.
Yeah. An example of that would be a person that cannot take the blame for anything. Now, it doesn't mean you have to accept blame for all things, right? There are some people, that's actually a sign of an unhealthy relationship too, is when you are taking all the blame on, or they are taking all the blame on for everything. Like, there's never 100% situation. It just doesn't work that way in life. And, it's going to be, some things are your fault, some things are their fault. But the point is to be able to sit down and talk about it, right? You have to be able to constructively discuss it and, move forward. That's a sign of a healthy relationship. An unhealthy one is blame and then, usually no forgiveness. And we've seen that.
Yeah. Jealousy and dishonesty.
Yeah. Jealousy and dishonesty, always accusing of, relationships being more than what they are, asking questions that, tend to be negative. And I mean, it's okay to ask questions, but again, it's the way they're being presented and how frequently.
More the accusing.
Yeah, more the accusing. Yeah.
Yeah. And then you already mentioned the denial and the gaslighting, but then also giving in on everything.
Yeah. Well, here's I'm looking at this right here. Here's some examples of unhealthy boundaries. Letting others define you. All right. You don't let other people define you. Like your relationships don't define you. They supplement you. All right. They're designed to kind of enhance what foundationally is there. And if you feel like you need a relationship in order to define you, then that's a sign where you need to work on yourself. You need to be comfortable with yourself and, comfortable in your own skin, so to speak.
Yeah. Well, you had brought up the the boundaries, and for some, it's like, because the question is, what is a boundary? Think of it as an invisible barrier between you and another. And so everyone has their own sense of boundaries, and basically what you're willing to accept, what you're not, what's okay with you, what isn't. And so being able to say, this is my boundary, do not cross it.
Yeah. I mean, everybody has them. Some people are more comfortable with them than others. A lot of the reason why relationships can go south is because of that failure to validate and uphold those boundaries. And we see that a lot. I see it in patients in practice. She sees it in her practice especially. Probably tends to be a little bit more common with women, but both sexes have issues with setting up boundaries or enforcing boundaries.
Right.
Speaking their minds.
Being able to set up one's own independent identity, kind of basically where you begin and end, where the other person begins and ends. And when that starts to kind of get a little blurred, then there's time to question the boundaries. Yeah.
And usually you can tell when a person has problems with their boundaries. It comes out in conversation. Usually if they're stressed all the time, oftentimes they do find they're having issues with boundaries. I see it more often with family, especially parents. A lot of times kids have problems, with their parents having boundaries, but it's also reversed. Like I'm seeing more and more parents having issues with establishing and maintaining boundaries with their kids. I see a lot of teenagers getting away with a lot of things they really shouldn't be. The parents, they're so stuck on being their friend versus their parent, and our main role as a parent is to guide them into adulthood. Like, I hear these things like, well, they just they have to be kids. It's like, okay, at the best, they're going to spend 18 years of their lives as kids. They're going to spend the rest of their life till they die as an adult. So really, like, what time is more important? Our job is to provide the guidance to get them into adulthood and to make them self-sufficient, because what you end up seeing is if you don't do that, then you end up with, it's kind of like the movie Step Brothers, where you got two 40-year-olds living at home with the parents who are pretty much like, directionless, and they're driving the parents nuts and they have no boundaries. And that's a great comedic example of it, but I see that a lot nowadays.
Mm-hmm. Yeah. And so some of the other, going back to the, where one ends, other begins, it's not just, because you can look at, your physical boundaries, your emotional boundaries. And so, we have multiple bodies that we're dealing with, and you have to be able to assess, it's like where those boundaries lie in each of them. Mm-hmm. Yeah. Do you want to give some more of the unhealthy or go on to the healthy?
Well, okay. So what was I was looking at, this example. Respect of others, not taking advantage of someone's generosity. So that's a sign of a healthy boundary. So to kind of go towards like the unhealthy version of that, a person that gives and doesn't necessarily receive compensation, and not to say that you always have to, but I do see this a lot with people. Like we did an episode and we talked about like entrepreneurship, and one of the problems that we see with entrepreneurs is overly giving and not receiving enough, right? So and it's okay to give, like sometimes you have to, but at the same time, when you get people that are chronically just taking and not giving back, that's a definite sign of unhealthy boundaries and unhealthy relationship. And you can salvage it. You have to go back and set the boundary. You have to define, like, here's the terms of the relationship. And so, and that's, you know, in that particular situation is I'm agreeing to give you X service and you're going to agree to give me, you know, Y compensation. So, and I, you know, that just kind of popped out to me because I had this issue very early on in my career. You know, my mentor called it a poverty complex. So, and I was kind of shocked and hurt by that. But, you know, when I took a hard look at myself, I realized I was like, I do have this poverty complex. Like, I'm afraid to charge what I'm worth, you know, for things. So, you know, just an example of, you know, healthy boundaries.
Mm-hmm. And speaking about how to move forward, once you establish that, yeah, this is, you know, toxic, this is what's happening. The big thing is to speak up about it.
Mm-hmm.
Being able to, you know, to talk about it, because, you know, and then also being able to, you know, assess, okay, what happens if I do speak up?
Yeah. Well, in this document right here, it points out like an example of a relationship where you may have unhealthy boundaries, and you need, again, to establish those boundaries or enforce them. Work relationships,
mm-hmm.
you know, sexual harassment, bullying. You know, bullying is really common, and that's an example of somebody taking some, you know, not acknowledging a person's boundaries and stepping too far across. And, you know, I mean, there are different versions of bullying. There's like cyberbullying. There's physical bullying. Back in my day, and I'm going to date myself a little bit here, but there was no such thing as cyberbullying. Like, bullying was physical, right? Dealt with it, and my way of dealing with it was, you know, getting into martial arts and choking the tar out of people. I don't recommend you do that today, but, you know, that was how I handled it. And so, but you know, it's really more constructive to learn how to handle things diplomatically, you know. And thankfully, like, my involvement with my state association and talking with people and, you know, experiencing the conflict, and my first reaction was to physically deal with it, but you can't do that. You know, you're going to go to jail. I'm going to lose all my assets. It's not morally correct. I had to learn how to tactfully, diplomatically deal with people who stepped over the boundaries, and, you know, basically enforce those boundaries, and, you know, try to maintain healthy relationships with them. So it's no different in any other place in life. Like, now, is that to say that you're going to be able to have a sensible conversation with the bully? Maybe not. You know, I mean, I'm a realist. So sometimes a bully is just a bully. They're just a jerk. And so, you know, one of the big things right here it says is actually, like, part of vocalizing is bringing attention to it. You know, confronting. Because a lot of times people, when they're bullied, they're isolated already. They're usually quiet. And so then they become more isolated, right? They become more withdrawn, and they don't tell anybody, and they hide it. A lot of times you do that because you're embarrassed. You think, oh, nobody's gonna understand, or they're gonna make fun of me, or, you know, whatever's going through your mind. It should be the exact opposite. You should bring attention, as much attention to it as you possibly can.
Yes. The other thing, documenting.
Oh, yeah. So, interesting point. So we, you know, of course, as employers, we have employees, and so we've had situations, one in very particular, where the employee was very toxic and really stepped over boundaries. And unfortunately, we allowed it, in the sense that we allowed our emotions to affect the way we handled disciplining her. And ultimately, what it ended up getting us is she ended up filing a fraudulent injury claim against us. And it took us off guard at first, but the thing that saved us is documentation. Like, we had actually documented things that had happened, and that's ultimately what saved us legally. So
yes,
yeah. And that's it. Anytime you think there could be a legal aspect to, you know, a problem, I would highly recommend documenting it, because in court, if it's not written, it didn't happen.
True. Yeah. Big thing, build a support network. You know, gather anybody that you know that you can regularly talk to. Anybody that, you know, may be able to help. Like you said, if it does become, you know, a legal issue, even just speaking hypothetically, say, what if, you know, this was going on, and, you know, just kind of really researching it and gathering as much information you can, but making sure that, that network is there for you, that the support is there. Because, every one of us is going through something, and we all need to make sure that, that we are taken care of, and that, that we have people that we can go to, and that we're not having to go through something alone.
Yeah, I like that. I like that right there. Network. One of the best things you can do to allow you to work through challenges, unhealthy relationships, boundary issues, is have a great support network. And the example you just gave right there, legal issues, seeking advice from people who are smarter than you at it, i.e., an attorney. A lot of people,
Yes.
a lot of people are afraid to go that route. They think that attorneys are all shady and scumbags. Ambulance chasers. I do personal injury work. I've heard that term thrown around. Oh, they're ambulance chasers. Oh, they're in it for themselves. I'll tell you what. Having an awesome, ethical attorney at your beck and call it's gold. It's like having gold. Like, they will save your neck. They will help you work through situations. And maybe all it is just a phone call and some advice, because a lot of times when we get in situations where we're confronted, we're in an unhealthy situation, we get scared, we get reactionary. We don't become proactive. We become reactive, right? And just to have that clear mind that's not attached to the emotional situation, to throw the ideas out there, to throw your thoughts out, and then get the healthy input in, is So anyway.
Yes, exactly. And so, okay, so you've made the decision, and you are now aware that either relationship you're in, whether it is romantic, work, family, friends, is toxic. And then it becomes a question of, do I stay in this? How much longer am I going to, it's like put myself through this? And then it becomes, okay, do I walk away from it all? Do I actually just say goodbye to those relationships? And for some, once the decision is made to just say, I'm done, I'm out, I'm not doing this anymore, and you decide, okay, this is over. And it can be very difficult for people to understand, but you basically have to just decide for yourself. It's like, no, it's time for me to take care of me. So self-care is huge. Once you actually decide, I can't do this anymore. And yes, it's like, especially if it is family, other family members are not going to understand, but being able to come out and say, I had to do this for me. I could no longer hurt myself any longer, and that's exactly what was happening regularly. And then work. Yes, that is the biggest challenge, because when your work environment becomes toxic, and then having to make the decision, am I going to leave this job? And then the possibility of, if I leave this job, where am I going to go? Where is my income going to come from? And so, and I'd say that, friends, yeah, it's very similar to, it's like to family, but I'd say that with friends, and the more that friends are becoming family, I think it is easier to confront and talk about it and say, hey, this is what, I've been feeling. This is what's been going on, being able to kind of timeline it a little bit. And then, from there saying, is this even salvageable? Mm-hmm. Right?
Yeah. Yeah. Well, yeah. Luckily, we've done a good amount of traveling and going around the world. One thing that we've discovered is that there's a lot of people out there, and you're going to find there's plenty of people that you have commonalities with. Mm-hmm. And so you should never feel as though a relationship is like it's an end all be all. And the reality is that if you've grown as a person, chances are many of the people that have been in your life, they're probably not there anymore, because if they haven't grown with you, you usually find that you just don't align anymore, and you end up having to go out and find new relationships to help you grow even more as a person. But it's also about allowing you to help other people grow too. That's another reason why we go out and we get different relationships, is to be able to help others grow, so that, it's kind of a term that I've heard used is psychic equity, right? Mm-hmm. We're investing psychic equity into other people, and vice versa. So,
yeah, one of the things, like you said, either going out and finding new relationships, but in the case of, say you have been isolated, or you have been, it's like divided or removed or whatever from those relationships you used to have, reconnect. Mm-hmm. reach out and
Yeah.
say, it's like, because, I actually had experienced that where for years I did not spend any type of holiday or anything with family. And so I finally had to say, I would like to come back. I would like to, reconnect, reestablish, it's like this, relationship. It's been years, months, however long it's been since, we've connected, since we've spoken, let's find a time to, to get together. So, reconnecting, rebuilding, and kind of, doing that emotional healing together.
Yeah, definitely.
Yeah. And then the other one, once you've decided to move on, and now that's when the healing comes in, seeking therapy.
Yeah.
Whether it's, finding a counselor and going, and doing talk therapy, it's like coming and getting some, body work done, it's like to kind of heal it from the body level, because, it's like, trauma is trauma. It shows up in many different ways. And so it is important, to basically clear it, to help, heal it. Biggest thing, being able to talk about it, write it out. You just need to get it out of you.
Yeah. Yeah. That's a great example right there. I know you encourage that with your clients, is you like to have them journal. It could be written, it could be audio, it could be video. It's just got to be something that you can get it out there. And the nice thing about it is having that reference material to go back, because what you'll find is you'll it could be years down the road, you go back and look at it and realize, like, oh my gosh, like, look how much has changed. Interesting frame of mind, and who knows, you may use it to guide other people with.
Yes. And just knowing that there is recovery.
Yeah, absolutely.
From it. It's like that, again, any type of relationship doesn't have to, define you. It doesn't make you who you are. It's not, it's like the end all be all. It's never going to be different. It's just being able to say, I'm going to change this. Definitely.
Well, I think we've given a pretty good amount of information today. And I hope you guys are taking away some really good clinical pearls, is in my world, that's how I would describe it. So if you like what you heard today, please hit the like button. Be sure to subscribe to our channel. And you can find us on YouTube, on Spotify, and all your podcast websites. And you can find us
on Facebook, Instagram.
Instagram.
Yes.
We'll be putting more content. Sorry about the delay on things. We just had to, it's been a crazy time with COVID. So everything's good though. We're on track. Things are definitely looking sunnier. So thank you so much. And we will be bringing you more excellent content.
Thank you.